which artery does this artery anastomose with? Gabby here from bootcamp.com, and in this dissection here, we're looking at the anterior abdominal wall. So right here is the umbilicus, right, which will be found along the midline of the body. So here will be medial. As we move this way towards the side, so we have lateral here and we have lateral here. So we have the left side and then we also have the right side. So this particular donor is looking at you as if it was an anatomical position. So here would be superior, so where we'd have, the breast, the thorax, and the rest of the trunk. And then here's going to be where the pelvis is, as well as the lower limbs. So this is going to be inferior. Now, having a look at the structures that make up the abdominal wall, we can see along the lateral sides, we're going to be able to find the external oblique. And deep to it right over here, right, we see these muscle fibers traveling in a more upwards direction. This is going to be the internal oblique. Some more abdominal muscles that are found more on the medial aspect and the more anterior aspect of the abdomen include the rectus abdominis. So we're going to be able to see the left rectus abdominis on this side over here. This muscle will essentially continue down here. But in this particular dissection, we haven't removed all the fascia that lies over top of that rectus abdominis. So same with the left side. So this fascia right over here is the anterior rectus sheath. So it is found anterior and superficial to the rectus abdominis muscle. So on the right side, we've actually kept the entire fascia intact, versus on the left side here, we've actually removed that fascia so we could actually see the rectus abdominal muscle itself. So this here, as well as over here, all comprise of the anterior rectus sheath. Now, there are a couple of vessels that are super important that are found along the anterior abdominal wall that are going to go ahead to supply and drain blood from that area and also supply and drain the rectus abdominis muscle. We see a couple of vessels here that are emerging from the more inferior aspects that will eventually ascend along the aspects of the abdominal wall deep to the rectus sheath. And we could also see another group of vessels right over here that are coming down from the superior surface. And eventually what happens is that these two vessels will eventually anastomose with each other approximately around the area of the umbilicus. So anastomose means they will connect with each other and share their blood supply. So this particular group of vessels are called the inferior epigastric artery and vein. Now, the inferior epigastric artery is going to branch directly off of the external iliac artery. It's eventually going to ascend and travel more medially along the anterior abdominal wall within that rectus sheath. And as it's ascending, it's actually going to go ahead and contribute to the lateral border of Hesselbach's triangle. And Hesselbach's triangle is a weak point, which is found along this area here of the abdomen, is a weak point within the abdomen where hernias can occur. So the inferior epigastric artery and vein both provide a landmark for us to find the lateral border of that triangle. So the inferior epigastric artery will continue to ascend along the anterior abdominal wall within the anterior rectus sheath, where it will eventually terminate in anastomose around the areas of the umbilicus with the superior epigastric artery, which we'll find right over here. So these two arteries anastomose, or they connect with each other, share their blood or mix their blood in order to provide blood to the areas of the anterior abdominal wall as well as the rectus abdominis muscle. So the superior gastric artery, however, is emerging from the more superior aspects of the body and is going to be coming off of the internal thoracic artery. So the internal thoracic artery is going to descend or branch off the subclavian. It's going to travel along the internal but anterior aspect of the thorax and eventually give off a branch as a superior epigastric that will go ahead and travel to the abdomen. So in terms of our question here, which artery does the inferior epigastric artery anastomose with? So in this case, the answer to our question should be the superior epigastric artery.